Hi everyone. Hope you're all well today. I wanted to come back to you today to talk about thyroid testing and the importance of testing your thyroid. So, as I explained yesterday, there are so many people that are slipping through the net because they are not actually getting the right diagnosis for their thyroid. And this can be really, really problematic because we know that the thyroid is involved in so many different processes in the body. And we know that almost every cell in the body has a receptor for thyroid hormones. So when our thyroid hormones aren't working properly, or we're not producing enough, or we're not converting sufficient levels of inactive thyroid hormone to active thyroid hormone, the consequences can be far reaching. So the problem we've got today is that the conventional testing markers that's being used to test for thyroid health is predominantly thyroid stimulating hormone, also known as TSH, and then also T4 thyroxine. So those are really important markers, and so they're key. They're important, and in respect to the doctors, they taught that TSH is a really important marker that's going to tell us whether there's a problem or disease or disorder going on with the thyroid. And on some level it potentially could do, but I think the key thing that I want to stress today is that thyroid stimulating hormone isn't going to give us the full picture of what's going on with your thyroid. So just to very quickly recap, because I don't want to spend a long time on this today, but I think the key thing that I just want to stress is just looking quickly how the thyroid is making thyroid hormone. And then maybe you can understand that we need to look at more than just TSH and T4. So when we think of the thyroid, I like the analogy of the thyroid being a thermos, and then a furnace, and then your pituitary gland being a thermostat. So if you think about, your body as getting warm, and then when there's not enough heat, the pituitary will be signaled, and it will release something called thyroid stimulating hormone, which is this marker that we're testing for. So thyroid stimulating hormone will then prompt the thyroid to produce T4 and T3, and that will then create heat again, and then your thermostat will be deactivated. So I'm using heat as for the analogy, but obviously it goes way beyond heat because it's also to do with our metabolism and so much more. So when we think about the thyroid, it's going to be producing T4, which is it predominantly produces T4. So 80% of thyroid hormone is T4, and then 20% is T3. So T3 is the active form of thyroid hormone, and it's actually a lot stronger. So it's about four times as strong as T4. But and so when the thyroid produces this, there's going to be predominantly T4 circulating your blood. So there's a couple more processes involved so that the body can actually convert the T4 to T3 so that there is sufficient levels of active thyroid hormone in the body. And some of these processes involves certain enzymes called deiodinases, 5-deiodinases, and these enzymes then convert your inactive form of thyroid hormone to the active form of thyroid hormone. There's a lot of other things involved in that. The body needs iodine to make the thyroid hormone. These enzymes, the deiodinases, are selenium based, so it needs selenium. We need zinc, and there's so much more involved in the process. But the reason I just quickly wanted to give you the recap is when your doctor is actually doing your thyroid panel, that they can't just be looking at T4 and TSH, because by looking at TSH, we can see that actually there is sufficient thyroid hormone being requested. And by looking at T4, we can see that there's actually enough T4 thyroid hormone being made. But what we don't know is how much of that is actually active, what is happening with that conversion. So really, when we when we look at the thyroid, it can take a very long time before that thyroid stimulating hormone is impacted. So for someone, there is some thoughts around the fact that it can actually take up to 10 years before we can see an increase in that TSH. And by that point, really, a lot of the thyroid might have been destroyed, especially if there is an autoimmune process involved in the body. So in my case, I actually didn't know I had a problem with my thyroid. And then when I tested sort of 5 years down the line, or actually it was longer than that, 6, 7 years down the line, because I think I tested in 2017, I then realized that I had Hashimoto's. And actually, even today, still, my thyroid markers with the GP is still within the normal parameters. So I'm going to try and share my screen, which will be the first time I've done this. I'm not really sure how that's going to go today, but I'll do my best to do that, which is now not working because I've started the video. Oh no, so that's not going to work today then. That's a shame, even although I practice it, it's not going to work. Okay. Well, what I wanted to share with you was a thyroid panel that basically shows you the key markers, but I'll run through those with you anyway. So really what we want to be looking for, we want to be looking for thyroid stimulating hormone, which your doctor will test, but we also want to be looking for beyond the free T4, which your doctor will test. So we also want to look for free T3. As I said earlier, that's your active thyroid hormone. So it's really important that we have enough active thyroid hormone in the body, because otherwise, it's going to be impacting your hormones because it's needed for hormone production. It's also going to be impacting your serotonin because it's involved in that process, and so many other functions in the body. So the other thing we want to test for is something called reverse T3. So we know that when the body is stressed, or maybe it's going through trauma, or it's got an infection, or even long periods of fasting, it can impact what's going on with those enzymes that's converting the T4 to the T3. And these enzymes, in the absence of them, the T4 can be converted into reverse T3. And we typically see that when the body is in a state of stress. And so this is then going to impact how much active thyroid hormone is available for the body to use. So that's actually a really important marker that we want to look at, because for a lot of people with thyroid issues, there's things going on with their adrenals as well. And so reverse T3 can be a key marker to look for. And it's also really important when you're dealing with someone who's got hormone issues, because we can often see that, when there is high levels of reverse T3, that can be impacting hormone production. So we can see that in PCOS. We can see that in, women who've got irregular menstrual cycle, heavy, estrogen dominance. So they might have heavy menstrual cycle. So I think it's really important that you get the full picture and not just those two markers. And then the other really important aspect of looking at your thyroid panel is that we know that around 90% of people with thyroid disease actually have Hashimoto. So this is the autoimmune component. So this is basically where you've got immune antibodies that's been created by the body to actually target the thyroid. So it's there to destroy the thyroid. And what we see in 90% of people with hyperthyroidism is that those antibodies are actually present. So what's going to happen when your doctor is doing your TSH test and your T4, they're not going to pick up that you might have Hashimoto's or Graves. And that was the case for me. My antibodies weren't picked up. And I think, I had all the classic symptoms, and it was completely overlooked because my TSH was well within range. It was 2, and my T4 was well within range. It was 8. And so what I want to stress further is, so it's great doing the functional panel because we can look at all these different markers, but it's also really critical that we don't just look at the markers, but we look at what ranges they're in. So when your GP is going to be looking at your thyroid stimulating hormone, they're going to be looking at a parameter somewhere in the region of, 0.4 or 5 up to 4.5 to 5. So that's really high. If my TSH levels were at 5, that's a really bad sign. So a lot of doctors won't do anything till your TSH levels are that elevated. And we know it can take a long time for that to actually manifest. So from a functional medicine perspective, we actually want to look at optimal ranges. We want to look and see how can we support your body so that we can hopefully detect a problem early enough, so that if there is an issue, we can try immediately get to the root cause and then hopefully help you to reverse what's going on. If we're leaving things so that TSH get to the level of 5, you're in trouble. So I'm not saying it's not reversible, but it's going to be a lot harder. So really in functional medicine, we're looking at a reference range for TSH somewhere between 1 and 2. And anything over 2 for us is a little bit of a red flag. So, okay, there's too much signaling going from the pituitary gland to the thyroid to say, make more hormone. So that's something that's really important. The other thing, of course, is the T4 as well. And again, you know, the reference ranges for that is much higher with your doctor. So we want to really, you know, or lower actually, we want to make sure that there's an abundance of thyroid hormones sitting in the body so that your body is at no time feeling tired or sluggish or struggling. And because the thyroid is playing such a critical role through all the different systems of the body, it's really imperative that you have sufficient thyroid hormones available in the body. And I think this is a key point I want to stress, because in conventional medicine, when we look at the thyroid, it's an endocrine problem, right? So you see the endocrinologist, or, you know, if it progresses. But actually, when we think of the thyroid, because it has, you know, every cell in the body, or most of the cells in your body have receptors for thyroid hormone, the problem goes way beyond your endocrine system. So it can impact your heart, it can impact your kidneys, it can impact your gut, it can impact your hormones, it can impact your brain. So it's really important that when we look at the thyroid, we get a comprehensive panel so we can see what's going on. So we have to figure out, is this an issue that there is actually a problem with signaling from the pituitary to the thyroid? Or is there a bigger problem in that there isn't a raw material in the body to convert your inactive form of thyroid hormone to active, you know, to the active hormone? You know, is there something potentially going on in the gut? And so it's great doing the functional thyroid panel. And it's something that I will do with every single one of my thyroid clients, unless they've already had a comprehensive panel done by their endocrinologist. But I think the big thing to stress is that that's one part of it. So you then still need to try and understand, well, what's at the root of it? Because having a thyroid disorder isn't your final diagnosis. You know, that is what you kind of ending up with. That's the end result of a load of other stuff that's going on in the body. So we've got to try and figure out what are the causes for this. And there are many. You know, it could be infections in your gut. It can obviously be down to your immune system, which is then potentially linked into your gut as well if it's autoimmune. It could be heavy metals. It could be mold. It could be toxicity. You know, it could be your blood sugars, it could be hormones. There are lots of different causes that can be driving this imbalance for your thyroid. But what I wanted to just talk to you about today really was understanding that when you're getting your thyroid labs done with your doctor, it's not going to give you a comprehensive panel. And over and above that, it's not going to look at the markers in an optimal range, because a lot of those markers are based on people who's already got thyroid disease. And we don't want to be working on the back end on being reactive. We want to be proactive. We want to be preventing things from getting worse and escalating. So ideally, if you've got any suspicions on whether you've got any problems with your thyroid, my advice to you is to really kind of get a comprehensive thyroid panel done, which you can contact me for, and I'm more than happy to support you with that. If you're unsure as to why you've got an underactive thyroid, then go and watch yesterday's video, or you can hop over to my blog post where I discuss, you know, how you can tell whether you've got an underactive thyroid. Thanks for watching today. Sorry I couldn't share my screen. Obviously, I had to set that up before I started the live video, but I know for next time. Okay, take care. Bye-bye.